is called the fundus. A 20-year-old female presents with severe lower abdominal pain. She does not believe that she is pregnant, but states that her breasts have been unusually tender, and that she has been nauseated. What is the pathophysiology of this patient's suspected condition? A fertilized ovum is implanted somewhere other than the uterus. After delivering a baby, and clamping and cutting the umbilical cord, you note that the end of the umbilical cord attached to the baby is bleeding. You should tie or clamp the cord proximal to the first clamp and re-examine it. All of the following processes take place in the uterus, except fertilization. The blank of the uterus is composed of 3 layers of muscle fibers that contract and help expel the fetus during childbirth. Myometrium. During the proliferative phase, estrogen stimulates the endometrium to increase in thickness in preparation for the reception and future growth of a fertilized egg. The egg is referred to as a blastocyst when it has been fertilized and enters the uterus and begins absorbing uterine fluid through the cell membrane. Human chorionic gonadotropin hormone sends signals to the corpus luteum, which in turn produces hormones designed to support the pregnancy until the placenta has developed. By the end of the 3rd week after conception, all of the following processes occur, except the embryo is officially referred to as the fetus. Which of the following is not a function of the placenta? Fetal protection against all harmful substances. Which of the following statements regarding the umbilical cord is correct? The umbilical vein carries oxygenated blood from the placenta to the fetus. Which of the following statements regarding the amniotic sac and fluid is correct? In the latter stages of pregnancy, the fetus swallows amniotic fluid and passes wastes out into the fluid. An immature egg is called a oocyte. Unlike the prenatal period, the gestational period is 38 weeks in duration. The uterine fundus is measured vertically from the top of the pubic bone to the top of the fundus. Which of the following statements regarding uterine fundus measurement is correct? Which of the following statements regarding uterine fundus measurement is correct? In addition to meeting the metabolic needs of the developing fetus, the mother's blood supply increases significantly in order to perfuse her own organs, especially the uterus and kidneys. A woman who does not take prenatal vitamins during the course of her pregnancy is at greatest risk for anemia. An increase in maternal cardiac output can cause a benign systolic flow murmur, which results from hypertrophy of the heart and dilation across the tricuspid valve. If a woman's pre-pregnancy resting heart rate is 70 beats per minute, you would expect her heart rate to range between blank and blank at term. 85-90. By the end of week blank of gestation, A woman's diastolic blood pressure should return to its pre-pregnancy level. 36. Which of the following changes occurs in the respiratory system of a pregnant woman? Minute ventilation increases by as much as 50%, which causes the PaCO2 to drop by about 5 mm Hg. At term, displacement of the diaphragm by the uterus causes a decrease in expiratory reserve volume. During the menstrual cycle, numerous follicles begin the process of maturation, but only one ultimately matures and releases an ovum. Gestational diabetes is caused by increased insulin production and decreased cellular sensitivity to insulin. Common signs of gestational diabetes include polydipsia, gestational hypertension, may be an early sign of preeclampsia. Common signs and symptoms of preeclampsia include edema, hypertension, and headache. The onset of eclampsia is marked by the presence of generalized seizures. Pneumonia can be especially virulent during pregnancy because the mother's immune system is already depressed. Which of the following statements regarding Rh disease during pregnancy is correct? During subsequent pregnancies, the Rh antibody will cross the placental barrier and attack the fetal red blood cells. Seizures during pregnancy should be treated with magnesium sulfate. The leading cause of life-threatening infections in newborns is Group B Streptococcus. Cholestasis occurs when hormones slow or block the normal flow of bile from the liver. As the pre-ovulatory phase of the menstrual cycle progresses, the anterior pituitary gland releases luteinizing hormone, which stimulates the release of an ovum. A pregnant woman with cephalopelvic disproportion requires a cesarean section to prevent fetal distress. Abortion is defined as expulsion of the fetus, from any cause, before the blank week of pregnancy. 20th. A spontaneous abortion occurs naturally and may or may not have an identifiable cause. Herbal preparations would most likely cause an induced abortion by making the uterus and bloodstream too toxic for the fetus to survive. Signs of a threatened abortion include all of the following: except severe abdominal pain. When caring for a woman with an inevitable or incomplete abortion, you should be most concerned with bleeding and shock. During third trimester vaginal bleeding, the mother may lose as much as 40% of her blood volume before significant signs of hypovolemia occur. In contrast to an abruptia placenta, a placenta previa usually presents with painless vaginal bleeding. Abruptia placenta is most accurately defined as premature separation of a normally implanted placenta from the uterine wall. Uterine rupture most commonly occurs during active labor. Luteinizing hormone stimulates the ovarian cells to release all of the following hormones: except oxytocin. Women who experience hyperemesis gravidarum have persistent nausea and vomiting throughout pregnancy that often causes dehydration and malnutrition. Which of the following would you most likely observe in a newborn with hemolytic disease? Jaundice. Following delivery of a stillborn baby at 16 weeks, the mother presents with fever, abdominal tenderness, and a foul-smelling vaginal discharge. This clinical presentation is consistent with aseptic abortion. A prima gravida woman is pregnant for the first time. If a woman is gravida 3 and para 2, she has delivered 2 babies. A nulliparous woman has never delivered a baby. A woman has been pregnant 3 times, has had 2 spontaneous abortions, and has carried 1 baby to term. You should document her obstetric history as G3A2P1. Women who have had a cesarean section can have a normal vaginal delivery. In contrast to gravida 3 mothers, gravida 1 mothers will typically take more time to deliver. When assessing the abdomen of a woman who is 36 weeks pregnant, you should expect it to be firm and non-tender. What is the corpus luteum? Remnants of the follicle after the egg has been released. Approximately % of all penetrating abdominal wounds to the mother result in fetal injury. 70. When dispatched to a residence for an injury involving a pregnant woman, you should be alert for evidence of abuse. There is a higher incidence of abdominal injuries in association with chest trauma in pregnant women because the diaphragm is elevated nearly 2 inches. Which of the following statements regarding abdominal trauma during pregnancy is correct? Use of a lap belt increases the risk of uterine injury. Which of the following assessment parameters is most difficult to interpret when a pregnant woman is injured? Pulse rate. The risk of aspiration in the pregnant woman is increased significantly because decreased digestion causes a delay in gastric emptying. If a pregnant woman is injured and is bleeding severely, blood flow will be diverted away from the uterus. The typical upper limit of the fetal heart rate is 160 beats per minute. If a woman who is 35 weeks pregnant is placed in a supine position, atrial preload may be reduced markedly. Premonitory signs of labor include all of the following: EXCEPT, contractions at 5 to 15-minute intervals. Which of the following does not occur after the ovum is not fertilized? The secretory phase increases the size of the endometrial glands. Cervical effacement occurs when the less muscular lower part of the uterus is pulled upward over the presenting part of the baby. During the second stage of labor, contractions become more intense and more frequent. Crowning is most accurately defined as the presenting of the baby at the vaginal opening. A woman is in the second stage of labor when she feels a strong urge to move her bowels. Which of the following events occur during the third stage of labor? Placental delivery. During true labor, the interval between contractions gradually shortens. A pregnant woman with a past history of a cesarean section is at greatest risk for uterine rupture. If your EMS system protocols permit you to administer oxytocin to the mother following birth to control severe postpartum bleeding, it is most important to ensure that she is not delivering a second baby. The fetal side of the placenta should normally be gray and shiny with a smooth texture. Which of the following statements regarding a breech presentation is correct? Breech presentations are more common with premature birth. The outer layer of the fallopian tube consists of a serous membrane that protects the tube. The most important pre-hospital intervention for a footling breech or transverse presentation of the baby is rapid transport to the hospital. When caring for a prolapsed umbilical cord, you should keep the presenting part of the baby off the umbilical cord during rapid transport to the hospital. Hydramnios is a condition in which there is too much amniotic fluid. When delivering multiple babies, you should clamp and cut the umbilical cord. Following delivery of each baby, average blood loss during the third stage of labor is approximately 150 milliliters. Appropriate care for postpartum bleeding in the pre-hospital setting includes all of the following: EXCEPT, carefully placing sanitary pads in the vagina, the most immediate treatment to prevent placental hypoperfusion in a pregnant woman who is lying on her back is to place the woman in a left lateral recumbent position. Uterine inversion occurs when the placenta fails to detach properly and adheres to the uterine wall when it is expelled. In pregnancy, magnesium sulfate is used principally for eclamptic seizures. The possibility of a seizure. Fertilization of an egg usually occurs in the fallopian tube. High-flow oxygen, a sanitary pad over her vagina, a large-bore IV, crystalloid boluses as needed to maintain adequate perfusion, emotional support, and prompt transport. Abruptia placenta. Absence of abdominal pain. Suspect hyperemesis gravidarum, administer high-flow oxygen, start a large-bore IV and give a 250 ml normal saline bolus, assess her blood sugar and cardiac rhythm, consider administering diphenhydramine if protocols allow, and transport promptly. Uterine rupture. Administer supplemental oxygen, establish a large-bore IV line, and set the rate to keep the vein open, provide emotional support, and transport her to an appropriate hospital. Tilt the backboard to the left side. You are assisting in the delivery of a baby. As the infant's head begins to emerge from the vagina, you should support the head as it turns and then assess for a nuchal cord. You are delivering a baby who is in a breech presentation. The baby's body has delivered, and you are attempting to deliver its head by lifting its body upward. After about 3 minutes, the baby's head has not delivered. You should place your gloved hand in the vagina, and gently lift the baby's face away from the vaginal wall. During your visual exam of a woman in active labor, you see a loop of the umbilical cord protruding from her vagina. She's in the middle of a strong contraction, and you can see the baby's head just beyond the cord. You should immediately instruct her to pant during the contraction. When fever is suspected in the newborn, you should observe for the presence of a rash. Which of the following anticonvulsant medications would most likely be administered to a newborn with seizures in the pre-hospital setting? Lorazepam. During transport of a newborn, timely intervention of acute deterioration is most effectively achieved by ongoing observation and frequent reassessment. Abort the intubation attempt and continue ventilations. If hypovolemia is suspected or confirmed, you should administer blank ml of normal saline to a 6-pound newborn over a period of blank 27, 5 to 10 minutes. What size and type of laryngoscope blade is recommended for use in a full-term newborn? Number 1. Straight correct. If you feel 13 pulsations in a 6-second time frame, the newborn's heart rate is approximately 130 beats per minute. Tetralogy of Fallot is a combination of 4 heart defects, including right ventricular hypertrophy. In addition to an IV dextrose bolus, the most important treatment for newborn hypoglycemia is proper thermal management. The single most common cause of seizures in both term and preterm infants is hypoxic ischemic encephalopathy. The recommended IV dose and concentration of epinephrine for the newborn is 0.1 to 0.3 milliliters per kilogram, 110,000. After inserting an oral gastric tube in a newborn, you should leave the tube open to allow air to vent. If a newborn does not respond to the initial steps of resuscitation, the need for further intervention is based upon respiratory effort, pulse rate, and color. Epinephrine is indicated during newborn resuscitation if the heart rate remains below 60 beats per minute after 30 seconds of effective ventilation, and an additional 30 seconds of chest compressions. During your rapid assessment of a newborn's cardiopulmonary status, you note that its respirations are adequate, you feel 8 pulsations in a 6-second time frame, and the newborn is centrally pink but peripherally cyanotic. The most appropriate next action should be to administer positive pressure ventilations. The risk of newborn complications is highest if the amniotic sac ruptured more than 18 hours before birth. Which of the following factors is associated with the highest risk of newborn hypoglycemia? Morbid obesity in the mother. Signs of hypovolemia in the newborn include all of the following: except persistent acrocyanosis. If a newborn requires epinephrine and peripheral venous access is unsuccessful, you should cannulate the umbilical vein. Chest compressions are indicated in the newborn if its heart rate remains less than blank beats/min despite effective positive pressure ventilations for blank seconds. 60/30. Which of the following statements regarding the Apgar score is correct? If resuscitation is necessary, the Apgar score is completed to determine the result of the resuscitation. Common causes of respiratory distress in the newborn include mucus obstruction of the nose. When an atrial septal defect is present, deoxygenated blood is able to shift from one atrium to the other and mix with oxygen-rich blood. In which of the following situations would a newborn most likely experience a seizure? 33 weeks gestation. You have just delivered a little girl who was born 4 weeks premature. There is no evidence of meconium in the amniotic fluid. After drying, warming, suctioning, positioning, and stimulating the infant, she remains acrocyanotic and is not crying. You should open her airway and assess respirations. An oropharyngeal airway would most likely be indicated for a newborn with Pierre-Robin sequence. An infant born with a pink body and blue extremities, a pulse rate of 90 beats per minute, a strong cry, and active movement should be assigned an initial Apgar score of 8. The most common device used to provide positive pressure ventilation to a newborn in the pre-hospital setting is a self-inflating bag mask device. Compared to subsequent breaths, the first few positive pressure breaths delivered to a distressed newborn may necessitate manual disabling of the pop-off valve. Newborn hypoglycemia is defined as a blood glucose level lower than 45 mg per deciliter. Signs of a diaphragmatic hernia include all of the following: except bilaterally absent breath sounds. The most common etiology for bradycardia in a newborn is severe hypoxia. A newborn with a pulse rate of 80 beats per minute requires immediate positive pressure ventilation. A newborn is at greatest risk for meconium aspiration if he or she is born at more than 42 weeks gestation. Causes of delayed fetal transition include all of the following: except birth at 41 weeks. After performing the initial steps of resuscitation, you assess a newborn and note that its respirations are poor and its pulse rate is 50 beats per minute. You should begin chest compressions if the heart rate remains below 60 beats per minute after 30 seconds of effective positive pressure ventilation. During the delivery of a post-term baby, you note the presence of particulate meconium in the amniotic fluid. Your post-delivery assessment of the newborn reveals that it is active, has a strong cry, and has a heart rate of 110 beats per minute. You should ensure that the infant is warm and dry, administer free-flow oxygen if needed, and provide continuous monitoring. Respiratory distress in a premature infant is most often the result of surfactant deficiency. Which of the following events is a critical part of fetal transition? Diversion of blood flow to the fetus's lungs. When performing chest compressions on a newborn, you should compress the chest 1/3 the anteroposterior depth of the chest. Naloxone is not recommended for use in newborns who are born to narcotic-addicted mothers. A newborn born between blank and blank weeks of gestation is described as term 38, 42. An untreated patent ductus arteriosus may cause subsequent development of congestive heart failure. A shift of heart tones and severe respiratory distress despite positive pressure ventilations is indicative of a pneumothorax. How much naloxone should you give to a 6.5-pound newborn with respiratory depression secondary to maternal narcotic administration? 0.3 milligrams. Total anomalous pulmonary venous return is a rare congenital defect in which the 4 pulmonary veins connect to the right atrium. Caput succedaneum is defined as temporary swelling of the soft tissue of the baby's scalp secondary to pressure from the dilating cervix. What dose in concentration of glucose would be most appropriate for a 6-pound hypoglycemic newborn? 5.5 milliliters of 10% dextrose. You and your partner are caring for a 5-pound distressed newborn. After providing 30 seconds of effective bag mask ventilations, the newborn's heart rate remains below 60 beats per minute. You should continue bag mask ventilations and initiate chest compressions. Choanal atresia is defined as a bony or membranous obstruction of the back of the nose. Apgar score. Delaying clamping of the umbilical cord may cause polycythemia. During delivery of post-term baby, you note presence of particulate meconium and amniotic fluid. Post-deliver assessment of newborn reveals RR 60, BP 60HR, and baby is not limbed. The most likely form of treatment would be ensure the infant is warm and dry, closely monitor and transport. Asterisk baby's muscle tone would have to be limp. Reddish hardening of the skin, usually within the first week of life/premature infants. Very rare form of paniculitis. Sclerema. You have been providing mag mask ventilation to a newborn with a sustained HRO 75 bpm/5 minutes. Infant's abdomen is markedly distended. Intubation is against protocols. The most appropriate intervention involves inserting oral gastric tube. Because stimulation of the parasympathetic nervous system and bradycardia can occur during intubation of a child, you should closely monitor the child's cardiac rhythm and HR. The most common device used to provide positive pressure ventilation to a newborn in the pre-hospital setting is a self-inflating bag mask device. When an atrial septal defect is present, deoxygenated blood is able to shift from one atrium to the other and mix with oxygen-rich blood. Newborn hypoglycemia is defined as a blood glucose level lower than 45 mg per deciliter. The recommended IV dose and concentration of epinephrine for the newborn is 0.1 to 0.3 milliliters per kilogram, 110,000. If a newborn does not respond to the initial steps of resuscitation, the need for further intervention is based upon respiratory effort, pulse rate, and color. The quickest way to prevent newborn hypothermia involves thoroughly drying the newborn after birth. When fever is suspected in the newborn, you should observe for the presence of a rash. A newborn born between blank and blank weeks of gestation is described as term 38-42. Tetralogy of Fallot is a combination of 4 heart defects, including right ventricular hypertrophy. Which of the following disorders or conditions is related to decreased glycogen stores in the newborn? Small for gestational age. A newborn with a pulse rate of 80 beats per minute requires immediate positive pressure ventilation. You have just delivered a little girl who was born 4 weeks premature. There is no evidence of meconium in the amniotic fluid. After drying, warming, suctioning, positioning, In stimulating the infant, she remains acrocyanotic and is not crying. You should open her airway and assess respirations. Total anomalous pulmonary venous return is a rare congenital defect in which the 4 pulmonary veins connect to the right atrium. The initial steps of newborn resuscitation include proper positioning. Which of the following is not an antepartum risk factor that increases the potential that a newborn may require resuscitation? Prolapsed cord. Which of the following events is a critical part of fetal transition? Diversion of blood flow to the fetus's lungs. According to the Upgar score, a newborn with a heart rate of 80 beats per minute and slow, irregular breathing should receive a combined score of 2. Which of the following statements regarding fever in the newborn is correct? Fever may not always be a presenting feature in newborns with an infection. The primary source of heat production in the newborn is non-shivering thermogenesis. Severely hypothermic newborns may present with sclerema, which is defined as hardening of the skin associated with reddening and edema. If hypovolemia is suspected or confirmed, you should administer blank ml of normal saline to a 6-pound newborn over a period of blank 27, 5 to 10 minutes. You are assisting in the delivery of a baby. After the baby's head emerges from the vagina, you should quickly assess for the presence of a nuchal cord, and then suction its mouth and nose. What dose and concentration of glucose would be most appropriate for a 6-pound hypoglycemic newborn? 5.5 milliliters of 10% dextrose. A newborn is at greatest risk for meconium aspiration if he or she is born at more than 42 weeks gestation. Abort the intubation attempt and continue ventilations. During your assessment of a 30-year-old woman in active labor, she admits to being a chronic heroin abuser and states that she last shot up about 6 hours ago. After the baby delivers, you will most likely need to give positive pressure ventilations. An untreated patent ductus arteriosus may cause subsequent development of congestive heart failure. In contrast to primary apnea, secondary apnea is usually unresponsive to stimulation alone. Mortality and morbidity are high among infants who are delivered at 24 weeks gestation, usually because of respiratory and neurologic problems. After performing the initial steps of resuscitation, you assess a newborn and note that its respirations are poor and its pulse rate is 50 beats per minute. You should begin chest compressions if the heart rate remains below 60 beats per minute after 30 seconds of effective positive pressure ventilation. Compared to subsequent breaths, the first few positive pressure breaths delivered to a distressed newborn may necessitate manual disabling of the pop-off valve. A shift of heart tones and severe respiratory distress despite positive pressure ventilations is indicative of a pneumothorax. How much naloxone should you give to a 6.5-pound newborn with respiratory depression secondary to maternal narcotic administration? 0.3 milligrams. Choanal atresia is defined as a bony or membranous obstruction of the back of the nose. During transport of a newborn, timely intervention of acute deterioration is most effectively achieved by ongoing observation and frequent reassessment. A delay in clamping the umbilical cord and keeping the baby below the level of the placenta can result in fetal polycythemia. Which of the following statements regarding the Apgar score is correct? If resuscitation is necessary, the Apgar score is completed to determine the result of the resuscitation. The most common reasons for ineffective bag mask ventilations in the newborn are inadequate mask to face seal and incorrect head position. A subtle seizure in the newborn is characterized by eye deviation. Your assessment of a depressed 7-pound newborn reveals tachypnea, pallor, weak peripheral pulses, a heart rate of 120 beats per minute, and a blood glucose level of 58 milligrams per deciliter. Which of the following interventions will most likely cause improvement in this newborn's condition? 32 milliliters of normal saline. Which of the following factors is associated with the highest risk of newborn hypoglycemia? Morbid obesity in the mother. A newborn born between blank and blank weeks of gestation is described as term 38, 42. The most common etiology for bradycardia in a newborn is severe hypoxia. If a newborn requires epinephrine and peripheral venous access is unsuccessful, you should cannulate the umbilical vein. After inserting an oral gastric tube in a newborn, you should leave the tube open to allow air to vent. Naloxone is not recommended for use in newborns who are born to narcotic-addicted mothers. The correct positive pressure ventilation rate for an apneic newborn is 40 to 60 breaths per minute. Respiratory distress in a premature infant is most often the result of surfactant deficiency. Which of the